So when people talk about autism and a lot of mental health conditions along with autism, which is not a mental health problem at all, and a lot of brain disorders and a lot of health in general, they often talk about the perfect diet. Or they talk about this diet or lifestyle that fixed or cured someone else. Well, I'm going to explain to you how that is oftentimes totally an incorrect statement when I say follow this diet or follow this lifestyle and you will be better. And that in fact, the perfect diet or the perfect lifestyle is a very individualistic thing that might require you to see medical professionals, do a lot of reading, and what is really the perfect diet for anyone with any mental health condition or that has a brain disorder like autism, ADHD, which is again not a mental health condition, is the diet that makes them feel the most comfortable. Because physical and mental health are very much related, but in a complex way that doesn't often get talked about. And that we just overgeneralize a bunch of advice. So before I get into specific examples to really illustrate my point, we can always see that a lot of advice with some common sense might not be applicable to everyone. If I tell running has great mental health benefits and many benefits for many people. However, if you have your knee is really messed up, should you be running 10 miles or a marathon every day? No, that's going to make you a lot worse. If you have a high fever, should you be exercising or should you stay home and rest? There's a lot of simple examples where everyday healthy practices can become dangerous. If you have a peanut allergy, peanuts are usually healthy, but don't eat peanuts if you have a peanut allergy. And I can go on and on with health and lifestyle. So what we'll see again is the best lifestyle is just the lifestyle that makes a person feel good is what I propose. So here we're going to get into some interesting examples of where healthy food can, in specific cases, not be healthy. A lot of people swear by the vegan and vegetarian diet, and for a lot of people it has remarkable health benefits, but they might need to visit a doctor a lot and supplement. But it actually has a lot of problems for certain people. First of all, in some places being vegan or vegetarian is more expensive because the free food or the food they can get from shelters that provide them food has meat in it, or the canned soups have meat in it, and it's oftentimes true that yes, a vegan diet in principle should be cheaper, but there's governments of subsidies and distribution, and also trying to get a balanced vegan diet is harder if you have limited money if you live in certain places. But beyond that, meat is a lot easier to digest. So even though meat can have the same amount of iron and protein and magnesium as vegetarian food, if you have really bad digestive issues or you don't know how to eat a balanced diet, meat can help you the most overcome the nutrient deficiencies you have. So meat can be good to eat if you have certain health conditions. And it's also a lot easier for people to balance the diet with meat instead of spending hours trying to figure out, I might be exaggerating, trying to figure out the exact balances. And that can be really helpful if you have a busy lifestyle, not the best lifestyle. Probiotics. A lot of people are swearing by probiotics these days. Probiotics is the thing that's going to cure autism, or it's going to cure depression, and autism doesn't need to be cured in any way, but probiotics, we've now seen in many cases that probiotics can cause something called brain fog. Now, well, not in many cases. In the specific case from NPR, and it was based on some follow-up studies, is that people that had severe digestive issues and got a big chunk of the intestines removed, they started taking a bunch of probiotics and they all started having these symptoms where they had brain fog. Because when most people get brain fog when they're sleepy, that's the most common cause, but it's when your brain is just not taking out in stuff and you can't express yourself. Maybe once it's already in you can think, but someone might say something to you and you just don't hear it, or you just don't notice something, and then when you try to say stuff, your tongue is just all muddled up. That's brain fog. It's like your brain is covered in a fog that things can go in and out easily. And then in the study, they found that all these people taking probiotics, and when they stopped getting the brain fog, but when they're taking a ton of it, they got the brain fog. Then they analyzed the blood and found chemicals associated with giving people brain fog that also came from the bacteria that they were eating. And these were normally good probiotics. I'm not saying probiotics is bad, but probiotics can be bad. Fiber can hurt someone's GI tract. Sounds weird, but like if you have a diverticulitis, is a problem where you have holes literally in your intestines, or any other problem like that where you have a major intestinal issue, fiber can cause those holes or inflammation to get worse. When you're healthy, it's good, but if you have a really bad flare-up, it can be bad. Caffeine can actually make you sleepy. I mean, yes, it can make you sleepy, it can help with dehydration, and it can help with headaches. It can increase focus, it can calm you down in some people, and some people can increase blood flow more, which can help your body go from return to normal and make you sleepy more. It's well known that it can decrease pain. It can decrease migraines in some people. It can help clear waste faster, but it's all very specific. We don't fully understand it, but we know that it alters metabolism, so a lot of painkillers become more effective, like everything from ibuprofen to aspirin. Common exogen is acetaminophen, which is Tylenol plus aspirin plus caffeine. It can help, it's a diuretic, which means it makes you urinate more, but that can actually help you with dehydration, because it can pump out stuff when you dehydrate, the toxins, and it doesn't make you dehydrated because there's so much water in most things with caffeine. The water always compensates for it. It's been known to help some people with certain migraines in some conditions. People with ADHD, like I said, it can increase focus like them. Same idea of giving them stimulants. It can open up blood vessels so your body can return back to normal. Just caffeine is a lot more complicated than it first presented, and it can have the same effect in it can have opposite effects in the same person depending on dosage, when they take it, how long they're taking it, and so much more. It can be addictive and effects wear off, or it can be a silent treatment. Potassium. If you have an overdose of potassium, it's worse if you have an underdose of sodium, and vice versa. So people that take too much potassium, taking potassium is not always good, especially if, and sometimes taking potassium you have to take it with sodium and vice versa. But sodium, people usually paint as bad from salt, but for a lot of people that are eating a lot of potassium, they need more sodium in the diet too. They work together. There's now some evidence that keto diet might be bad for some people with migraines. We do know they can cause migraines and headaches, other problems, and liver problems, and kidney problems in short term, but over the long term, some people are wondering if keto. Now, we have definitely seen that keto diet in many trials does not improve migraines. And it might be improving migraines by causing weight loss or something like that. Indirectly, but not directly. Fat can be good for the brain. It can be good for the brain. It can be good to build cells up in the body. Fat can be good. Vitamin A and beta carotene. You look at 2 vitamins. Are they bad? Well, usually these vitamins support the immune system. They also help you see better at night, and they do a lot of other things. They're good for the heart, but they increase your chance of certain cancers. And if you have a lot of them, they decrease your chance of surviving cancer. A lot of cancer, especially lung cancer. The reason why is they increase your immune system, yes, but your cancer can hijack your immune system to cause inflammation and spread around your body more. So too much of something that can help your immune system can actually hurt you. Gatorade and soda can be good. There's literally out here published studies about using Gatorade and soda to treat dengue fever. You can use it to cholera, a bunch of other diseases, fevers and gastrointestinal, and it really can help with dehydration. But it also seems to have different effects with reducing fevers that are well documented, well supported by large peer-reviewed studies, and it can help people with diarrhea and gastrointestinal problems by restoring balance not only with the electrolytes, rehydrating so you don't only get the water, you get the electrolytes that you're losing when you're sweating a lot from a high fever, when you have a lot of diarrhea or urination problems, but it also seems to install balance in the digestive tract, so your digestive tract doesn't have to work as hard because the osmotic pressure, which is how much water wants to go one way or another way, or fluids, is more equal because the Gatorade is closer to what your body should be inside, so it doesn't have to pump or work as hard to do everything. It really does work, and soda can help with migraines, with the caffeine and hydration. And it can also be used to treat stomach problems. Normally, Gatorade and soda is bad. Normally. So, again, how does this relate back to autism or mental health or all these things? It's complicated. I can't look at a person and figure out what is the best diet for them. Diets are built on a very individualistic thing. There are autistic people out there that cannot have a easy maintain a vegetarian diet and be healthy, or cannot maintain a keto diet and be healthy because of what they eat, but they also may not be able to maintain a diet low in fat because they may have, an instance, maybe they're allergic to peanuts or high peanut diet. What's probably going to be good for them is a healthy diet for them. And a lot of these ones that do show evidence, like the probiotics, overdosing on probiotics, that can make them sleepy. What is a good diet for people is probably a diet that just makes them feel the most healthy. And a lot of these diets that do show promise, you look at them and they're all just healthy diets, and they would work equally well in non-autistic individuals just by making them healthier. If you're healthier, you have more energy, you have more focus, you're less likely to have sensory issues, you're less likely to be in pain. Like, that's the benefits. The benefits come from being physically healthy. Nothing extreme or wild. Another way that I could do is that sensory diets are a very important part of it, and I'll get more into them. But some people cannot handle certain flavors well. They get disgusted. Or some people can't handle certain textures. So there's also a psychological aspect of finding a diet that makes the person feel good. And feeling good with what you eat is really important. It's a really important source of happiness. You know, how people love the home cooking. That can be a great source of happening, or they like a certain diet style, or they eat the ice cream or desserts when they're feeling down to make them feeling good. Yeah, so all this dietary science about the cure, no, it's probably a lot of it's just plain pseudoscience, and other ones just about being healthy. The same as with mental health. And we should stop generalizing big scientific studies to people when they can be very individualistic things, and you need to talk to your doctor. And it's not about curing these things. Now, mental health is more a thing that needs to be really worked on. And that is, again, it's whatever makes the person the healthiest. It's not a specific diet for mental health. And the reason why all these studies go in depth is I have a previous video with a link on stats and lies, but the stats that are used in these studies to make these broad conclusions are horrible because they really do not take well into account individualistic people, and they're really bad at separating cause and effect and correlation. They're really bad with that. I have a whole video about that. They also cannot tell. They take the average, so they find the ideal diet for the average person, not the individual person. They give it a lot of variance. They also cannot find small effects well often, so instead they use very extreme things. So like a lot of the things about how fat was bad for you was based on people that eat extremely, extremely fatty diets. A lot of the ones that about how nuts can be unhealthy for you, those people that ate a ton of nuts or had allergies to the nuts. Almost every single one of these diet tiers was originally based on a very extreme condition, which is not true. Anything in extreme doses can kill you. Water can kill you in extreme doses. Too low can do it. So extrapolating that can be very, very hard. And things that culture and groups of people are very important. I have a limit to how spicy food I can have. Some people can eat much spicier food, some people less. Does that mean spicy food is good or bad for you? Well, for me, if it causes stomach problems, it's bad for me. However, for spicy food can also reduce the risk of a lot of heart disease. Again, very individualistic. Let's stop generalizing. And you should watch my video of stats that I'll link below to get a better idea how they really messed up the stats. Individualistic. Now let's get onto the mental health and people exaggerating mental health claims. Okay, people say now that don't complain, it's bad. Well, there's multiple studies on the complaining in certain situations can be good. People can bond over complaining. You know, when your two friends have a relationship, they just about complaining about how awful classes are. Complaining can get stuff off your chest. Complaining can get you to recognize a problem, so you fix a problem. If no one is talking about a problem, the problem never gets fixed. Complaining can lead to a sense of humor. Now, complaining can also be bad, and you can roll up and be stuck in complaining. My suggestion is try to keep your complaints in perspective, use humor, and make sure when you can complain a lot, but make sure you also take the time to take joy in other things besides complaining. Try to balance it out, which is easier said than done, but also add humor. Look on the bright side, or try and be optimistic. There's some evidence that it can be bad for your mental health. It can lead you to being overly confident and failing, and that failure can hurt you. It can lead you to not taking things seriously, which in the long term can hurt you. It can lead to a lot of other things like that. It can also lead you to overlooking systemic problems. Now, these are more theoretical. There's a bunch of people that wrote about it, but they don't seem to have the best data. It's more just anecdotal by people who are experts that work in psychology. But what we do know is from many, many studies that trying to be happy can make you less happy because you blame yourself for not being happy, or you're overly focused. They don't take the time to live in the moment, or you feel same thing as like if you're trying to lose weight, you can get even worse health because you feel so much pressure to lose weight, or anything. Just the pressure can be debilitating. I couldn't find discussion on it, but there was some interesting discussion, and I'm not aware of any scientific study to do it, but some people think that pain might be a good thing, and we should expect self-harm a little more. Now, I'm not talking about extreme ones that debilitate you, but the idea is pain we do know can be stressfully physical pain. Some people have proposed that mild physical pain, just like slapping yourself, we should accept it more as a way of stress relief or joy in life, and that might be a good positive thing. The idea is we accept it in masochism, sadism with sex. What about pain in a non-sexual setting? Now, that was in discussion I could not find, but it was an interesting idea, and it's something you maybe want to think about. This even states that mindfulness can be bad. Mindfulness makes you, can destroy some people's sense of self, or it can make people feel a less strong motivation or anger to do stuff, and that can actually hurt someone's mental health. And some mindfulness practice, they've also shown can increase anxiety in some people. Now, this is not all people. It also depends on the extent that it's done. But they don't recommend mindfulness over too much mindfulness practices. Some people are starting to not recommend it for people that don't have too much of a sense of self already, or need to move around, or that people have anxiety related to being confined or locked up or some stuff like that, or that they should only do a little bit of mindfulness, not too much. Like, you need sometimes to take a mental health day where you take a break, do nothing, sleep in, eat the ice cream because it's good, but you can't do it every single day, obviously. If you do it every single day, you will be unhealthy. So it's a balance. So it's a good idea. Yeah, we keep promoting as mindfulness as the cure for everything. So What I'm just saying is that all these health advice about the perfect diet, the perfect practice, the perfect amount of exercise, the mental health tips, they're all complicated. Mental health, the better you physically, the better your mental health is. 100% true, but how to make someone physically better? It's a very individualistic thing, and you shouldn't give broad advice. What's good for your mental health? Very, very broad, very individualistic thing. And besides being a very individualistic thing, there are a lot of other things that are complicated, like long versus short-term things. What I mean by that is, sometimes eat the ice cream, eat the unhealthy thing, because it's going to make you happy if you're sad. But if you do it every day, that can lead to a lot of bad health. But eating it once in a while to get over a little thing, well, not a little thing, it's probably something big if you eat a tub of ice cream. It can make you feel happy, and that joy can help your mental health, but it can also, joy makes you more physically active. It can make you enjoy life more, go out and be out in the world, and that can increase your physical health. Stuff that's good for your mental health can make you more physically active, more physically healthy. It goes both ways. Mental health, the better your mental health, the better your immune system, the happier you are. So short-term things, also like a lot of medications, good short-term, bad long-term. Everything is that. But something that's good for long-term might be bad, might not work in the short-term. Like getting about fiber. Long-term fiber can be very, very good for you. But if you're having a flare-up with little holes in your intestines, eating fiber can cut and make those holes worse. People that have struggled with all illnesses, they're always trying to balance these long and short-term effects. When should they take medications? When they shouldn't? When should they take a mental health break? When do they need to go back to the real world after break? Should they just lay in and sleep because sleep will get them healthier? But when do they need to go back to the gym and actually exercise? Like, it's so complicated, and no one knows has the perfect balance. It's also a very personal thing. What's the best diet is very personal, and we don't have good ideas really for a lot of things. What's the best thing for a person, and you don't know it, so don't give strong advice. Maybe just give ideas, but don't give strong advice. And also consult experts if you really have a thing, and I mean like doctors and stuff, and read the literature, but be careful. The biggest red flag in literature is literature that claims like the golden bullet or the silver bullet, claims miraculous results or generalized results. Be careful. And also really just listen to your own body or your own self, and knows your own self and what works for you and what doesn't work for you. It can be very, very individualistic, and it can be hard for some people, such as me, because I'm not very aware of my own body. I'm oftentimes very thirsty and I don't even realize it until I stop. Or I'm in pain and I don't realize it until I stop doing something. And that can happen to a lot of autistic people. So I would say even try constantly to notice your own health and make correlations and try to get ideas. But don't take any one idea too seriously, because everyone is different and there's always little exceptions. And the final thing is, your advice just might not be doable, or advice that people give out there for all these things might not just be doable for that average person, even though we do have like wonderful ideas. So I want to talk about dealing with chronic pain or pain after things. They found many ways that they can just get rid of almost all opioid use in a person. For people with a lot of chronic pain conditions, they found that you can reduce opioid use by over 75% in most cases by using meditation and going to therapy a lot. When it was back-related pain issues, they did a lot of physical therapy, and they found an over 89% reduction. There's even higher reductions by using combinations of over-the-counter drugs and many more techniques that are a lot safer than opioids. So why don't everyone do these techniques? And physical therapy really can be wonderful for a bunch of pain and related issues. And why? But why? Well, first of all, these studies were massive. With each of these studies had thousands of participants, and there are a bunch of good analysis. These are really good numbers. But each of these studies, none of these treatments were covered by insurance. So, poor people, you're out of luck. Second of all, the ease took so long. Some of these treatments took hours every day. Some people just don't have the time for these treatments. They take a lot of discipline, and they required, each of them were done by experts. And physical therapy can be a miracle cure for some people with certain conditions, but you really need to find the right physical therapist, and we don't hold them up to the same standards as we do doctors. So there are great physical therapists for a host of range of issues that use very complex techniques in themselves. Very, very complex techniques, and we know what they're doing. And then there's the Saudi little doctor that got the degree online and opens up a clinic, or that does pseudoscience. There's both. The same as with meditation. And also it's an individualistic thing. Again, it works for some people, it didn't work for everybody. So people just don't have the time, money, or the experts, and it's awful. So it can just be hard to do. And also, are any of us perfectly healthy or perfectly fine? Many of us struggle with issues with weight, with getting the right amount of exercise, so we shouldn't blame other people for those ones, especially if you're not taught at a young age. You have to learn these things at a young age, oftentimes, to be good at them, and most people are not. So with all those issues, please just don't blame people for not, and when you give advice, give it softly. Say, maybe this will help. Don't try to cure autism. Autism is not a disease. When it comes to physical health, when it comes to mental health, do try to help, but lightly, and realize it's hard and it might not work for them. Some of these things take a lot of time, and there's no golden bullet. Everything helps a little bit. And that's the end of my talk. I hope some of these examples were interesting at least, and may have opened your eyes to be a little more critical of all these suggestions. Thank you very much. Please subscribe, like, and share. Comment if you want to. It really does help the channel. And I have the better mic equipment, but I just need to figure out how to hook it up. Literally. Thank you very much.